Hello, everyone, and welcome to the final audio and podcast in this particular series around the LabZtorm critique. This is The Scientist, and this is an audio podcast series in part 2 or V2 of the LabZtorm effect. This is an audio podcast collaboration audio podcast collaboration between the ZtormLabostix production between a ZtormLabostix production in collaboration with the Renal Patient Support Group, the RPSG, and today's audio podcast will be about education, empowerment, and practice excellence, and this is an overall review relating to a peer review publication that was published in the journal of published in a kidney care journal or kidney practice journal, and it was published this Renal Patient Support Group peer review publication was published in around September, October 2021, and it was a collaboration also between the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group for Kids, or KDARS for Kids, and two academic institutions, the University of West of England, the University of West of England, UWE, and Coventry University. Both academic institutions are based in the UK. And so, as in the previous audio and podcast, I'm going to give a summary or an overview excuse me, an overview of this topic, highlighting just some background and some aims of some excuse me, some aims and objectives. Online, so to start off with some background, some online sort of portals and spaces has allowed patients with long-term conditions to access supplementary or educational support or information relating to health and disease through a range of sources, and the context around that is highlighted in this peer review publication, but also in relating to a work by Van Dam in a peer review publication in 2017. However, despite advances in despite advances in and around technology, integration between education searching versus knowledge implementation is and has been compromised between patients and healthcare professionals. The wealth of information available online for patients is vast, is sort of manifold, but much of it can be daunting and also again lead to misinformation. Patients with long-term conditions require or need to be sort of signposted or directed to resources that are appropriate for healthcare requirements, and that's in context. There is some work by Chris Denson and Sue that have been published back in 2013 in that regard. Support for patients with long-term conditions from professionals can be multifaceted, and patients benefit from scheduling time with allied health professionals, so health professionals that are from different parts that play different roles in aspects of healthcare, who are and also trained to provide sort of educational support, although in aspects of healthcare and healthcare delivery, the focus around the educational support side of things has not been sort of part of routine healthcare practices, and so scheduling time with allied health professionals who are trained to provide remote sort of educational support in different ways, including doing through a remote effort, in remote ways, for example, can have some advantages, and so for in this context has been high. So there's a paper by Barnett and team in 2012, and Sabara Marion in 2000 and team in 2017, that sort of look into some of those aspects. For example, chronic kidney disease, or CKD patients might find education on the reasons behind frequent blood tests and investigations helpful, and there's work by Crinson and team in 2010 and Bryan and team in 2014 that highlight some of that in some contexts, and such initiative would be supplementary to aspects of routine clinical practice or routine healthcare, and as part of electronic patient records, or EPRs. And then since 2009, the Renal Patient Support Group, or the RPSG, has a standing has historically a standing of offering evidence-based educational support for patients and health professionals across social media and different social media platforms, and as an established website portal. Online portals can improve patient documentation by facilitating more complete records to be kept with fewer errors, alongside improved ease and efficiency on behalf of health professionals maintaining records as well. So in this context, the outline of this particular publication was to highlight that how through online spaces, or the website portal and the different social media platforms attached to, for example, the or linked to, for example, the Renal Patient Support Group, or the RPSG, can be advantageous to those who are looking for additional, or that sort of educational support around aspects to do with chronic kidney disease, and so providing a sort of documented education, so thus patients and even health professionals implementing or using aspects of the RPSG and can be a source for documenting as part of the evidence in relating to ongoing healthcare for patients who are going through this particular health concern. So providing documented education will also reduce, or could also reduce, unnecessary complexity, reduce duplication, and improve collaboration between multidisciplinary teams. Telemedicine links for video consultation, imaging, and laboratory data could also allow laboratory teams to be more involved in discussions with chronic kidney those in chronic kidney disease remotely or through group consultations by being more involved in those sort of multidisciplinary team efforts. And what what needs to be clear, or what I want to highlight here, is that the RPSG doesn't have, as far as I'm aware, does not have sort of those things to do with telemedicine links for video consultations, imaging and laboratory data, for example. But what it does have is lots of different sources, sort of areas and focuses that relate to webinars, podcasts, and different works that involve different kinds of professionals and patients, of course, and where patients and health professionals are looking to sort of supplement aspects around what's referred to as patient and public involvement, patient and public involvement efforts around aspects that relate to chronic kidney disease or CKD and other health concerns. The RPSG has a website where there is where both patients and professionals can use to actually ensure that areas around areas and focuses around patient and public involvement are being met, and also there is again, the RPSG has an evidence base wherein there is a lot of peer review publications through their RPSG ResearchGate page, for example, that highlights lots of different areas of focuses around chronic kidney disease, and so on and so forth. And of course, any education provided would require documenting and transfer of information, connectivity of any technologies or links between electronic patient records and electronic patient records and general data protection records or records, or the GDPR from 2018 would have to be where information and educational support in relating to anything that goes into patient records would have to be GDPR compliant. And the RPSG has a basis where at this time there is information and context there where both patients and professionals can use, and if it is being used, then that can be documented alongside with the patient's records in relating to educational support, supplementary support, or informational support. In this context, the terminologies I'm using are synonymous. The aims and objectives of this particular peer review publication was to highlight if and whether it is advantageous to involve multidisciplinary teams or MDTs in through online consultations and or educational sessions through the Renal Patient Support Group, the RPSG, and social media platforms, and to improve educational practices around healthcare and health literacy for those going through chronic kidney disease. The review of this peer review publication seeks to understand if it would be helpful to have follow-up online consultations with MDT for healthcare following routine nephrology appointments, or through as part of nephrology routine nephrology services. And so in this again, the RPSG has various social media platforms attached to the website, and in this context, where educational support is required or can be required, again, the social media platforms, including, for example, an educational channel and an audio podcast channel, for example, those can be accessed, and they're free at the point of care, and basically where audios and podcasts are being used or can be used or accessed, basically in this context, patients or carers or those and health professionals who are going through the different aspects of developing their understanding and knowledge base around chronic kidney disease can choose to access those the content and sort of approach the RPSG as a way of sort of getting understanding and learning and developing, so that in relating to nephrology healthcare and practices more generally can be used, are and do become more sort of more contextualized as part of general healthcare. Now, this peer review publication does have some more context about content and context around why, asking the question, why is healthcare education is important, and amongst other aspects. And the peer review publication also provides a perspective really from an adult nephrology perspective, as well as a pediatric nephrology perspective. And so thus this is sort of an overview sort of audio podcast around this clinical focus around this topic around education, empowerment, and practice excellence. So I want to say thank you for listening to this audio and podcast, and this audio podcast ends this particular series on the LabZtorm effect v.2. This is around the LabZtorm critique, and this has been another ZtormLabostix production in collaboration with the Renal Patient Support Group, the RPSG, and this has been the scientist. I hope you've enjoyed this this series. Hopefully we'll be looking to collaborate again, and highlighting a few more of the peer review publications that have come out from the RPSG. But feel free to check out the context around the RPSG at your own leisure, and there are lots of different different focuses around the RPSG, so make sure you get a good kind of a good opportunity to check out that in your own times. So this is the scientist saying thank you for listening. This was once again the final audio podcast on the education, empowerment, and practice excellence. This has been an overview of this particular topic. Thank you.